So we're at 587 in terms of the county and the city of Houston for those that tested positively for COVID-19, and the death count is at 8. Let me say to you, we're doing much more testing now in the city of Houston, and it's not just the testing sites that the city of Houston has, but there are also additional testing sites in the city of Houston. So we expect those numbers to rise. We expect those numbers to rise every single day. Sometimes, like yesterday, the number could be 48 or somewhere in that number range. Sometimes the numbers could be 81, like today. Sometimes the numbers can be more than that. But what is the objective? The objective is to rise at such a level to slow the progression, so that whatever the number is, the people who are needing to be attended to in our hospitals can be attended to. Those that may require an ICU bed, that they can get an ICU bed when they need it. That there is not a problem, for example, with ventilators. So the goal is to blunt the progression of this virus, to blunt it, to flatten the curve, so that we can stay within our healthcare delivery system's ability to provide the necessary care that is required. That's the goal. So it's not so much the rising number, is how many are needing to come into the hospitals and to get to utilize those beds, and then how many can self-resolve their situations at home. And as of today, we are able to handle the load within our healthcare delivery system. That's where we are. So again, I'm going to continue to ask people if you will engage in the social distancing. Stay at home unless you're working for an essential employer. Stay at home. That's important. You can still go to the grocery stores. The grocery stores is not a problem with the food chain or anything of that nature. Grocery stores are not shutting down. You continue to go to the parks. But let me just say, if you go to a park and it's crowded and you can't engage in social distancing, then either find another park in the city of Houston, or kind of go, stay in your neighborhood and walk and jog right down the streets in your neighborhood. So those are the things that are very important. In terms of the 2 new deaths that we are reporting today, and Dr. Purse can speak more to it, is a male in his 40s with underlying health conditions who passed away on March 27th of this year. And then a female in her 60s with underlying health conditions who passed away on April 1st of this year. Starting today, the Houston Health Department will release demographic information about the city of Houston's COVID-19 cases, such as the number of positive cases, the patient's gender, age group, recovery status, and deaths through HoustonEmergency.org. That's HoustonEmergency.org. And we'll also be sharing that information with ReadyHarris.org. The information will be updated daily at 4 p.m. And available online. And the Houston Health Department reports cases involving residents of the city of Houston, including the incorporated areas of the city extending outside Harris County. Harris County Public Health reports cases involving residents of unincorporated Harris County. Then let me also say, because there have been some inquiries, and so let me clear the air, any city of Houston employee that tests positive for COVID-19 will be presumed to have a work-related acquired COVID-19 illness. So let me say that one more time so we'll be very, very clear. If you are a city employee, police officer, firefighter, municipal worker, if you test positive for COVID-19, the presumption will be it was work-related. That will be the presumption. So there have been some reports saying that was not the case, but I want to be very clear. I want to speak directly to the employees. We speak directly to people in the fire department, directly to our personnel, police officers, directly to municipal employees. If you test positively for COVID-19, the presumption will be by this city that it was work-related for workers' comp purposes. Firefighters who are placed in quarantine for COVID-19 action or initially carried on workers' compensation. If the employee develops no symptoms, does not meet the criteria for testing and receives no medical care while in quarantine, and the workers' comp claim is denied as a result, then the employee will be carried on an alternative pay code that will track the employee's absence from work, but not reduce the firefighter's personal benefit time. So even if you are quarantined, and again, let me speak directly to the firefighters, even if you are quarantined, you will be carried on workers' comp. You're not going to lose any of your time, okay? Meals, lodging, all of that will be provided, okay? And so there's no, you're not going to lose any of your time. And then if you are tested positively, comes back positive, the presumption will be that it was work-related. I want to be very, very clear, and I want to speak directly to the City of Houston employees, and that applies across the board. At this point, let me yield and let me turn it over now to Dr. Purse.
Two more Houstonians today. One is a gentleman in his 40s, that is the youngest death that we've had, and a woman in her 60s. Both were hospitalized at the time. You know that the dates of death were several days ago, and the reason that they're being reported today is today's the day that we got the test back that showed that they were infected with the virus at the time of their death. I want to point out that as sad as this is, we need to all pay attention because these individuals were infected by somebody else. I'm not trying to throw whoever infected them, say anything negative about them, but the point is that this is a disease that spreads from one person to the next. And this is why we need to take the precautions that we're taking with the social distancing. The concept of asymptomatic spread is real. In the beginning of this, we didn't think that that was going to play a very large part in the equation with this virus. This is one of the things that's unique about this virus, and that asymptomatic spread seems to be, or we call it, we're also calling it pre-symptomatic spread, seems to be a little bit more, a bigger part of the equation than we had anticipated it would be. Therefore, even if you're feeling well, you need to do as the mayor has said. Do not gather, stay away from each other. If you feel ill, you need to stay at home. If you need to seek medical care, do so, but call ahead, let your doctor or the hospital know before you arrive so that we can protect our healthcare workers, which are another precious resource. Please do not call 911 and ask for an ambulance if you don't need the ambulance. Those firefighters are also a precious resource. We can't afford for any more of them to be exposed and suffer the consequences of being in quarantine and the burden that it puts on the department. So these are all very important. Every one of us needs to be responsible. I think that I have seen that people are acting better. Let us not let these folks' deaths have been in vain. Pay attention and do as the mayor asks. Thank you.
We're doing all of these things for social distancing, we're staying at home. Is it working, Mayor? And let me just say to you, yes, it is working. And when you look at where we are, and let's say draw the comparison to New Orleans, look at where we are, and I think you can see the noticeable difference. And then not just in terms of the number of people that are testing, when we're looking at the number of people that are going into our hospitals, the number of people that are within our ICU, and our capacity and what exists. What Dr. Callender said the other day, that our hospital systems, even as of today, they're able to handle the caseload within our hospital capacity. That's good news. That's a positive statement. And now what will it take for that to continue? It means that those of us who are not in hospitals, those of us who are able to either go to work and work safely or stay at home, we control each other's destiny. You control my destiny, I control yours. And so if we continue to engage in social distancing and follow and be disciplined in what we are doing, then we can help to blunt the progression of this virus, and then the quicker we can come out of it. So again, let me thank you for your cooperation. Let me thank you for your compliance, and I'm hoping that you will continue to do it as we go through this weekend and as we approach Sunday.
Everybody know that we are in a manageable situation as far as the inventory of our personal protective equipment to maintain operations, to ensure that our firefighters on the front line have all the personal protective equipment they need to safely do their job. As in regards to the quarantine, today we're down to 141 firefighters in quarantine. Through the course of this operation, we've had 13 firefighters that have been positive for COVID-19, 2 and maybe 3. I still have to get confirmation on the third one this morning, but possibly 3 have recovered from that and are back to work. And in the course of the operation, we've had 48 firefighters return to work after being quarantined for exposure to COVID-19. So at this moment, we are operational. We are staffing every unit that we have available, and we're doing every bit that we can to ensure that we're providing not only the equipment, but the right policies, the right procedures, to ensure that our firefighters are safely meeting the demand in the city. Thank you.
And everyone up here for your work and your leadership, and thank you for your position on the injury and the exposure for our employees. I think that gives them great sound mind, and it just relieves a lot of folks, and it speaks as to your care for our people. But I'm going to give a quick update on where we're at from a police department. First and foremost, it's important for everyone to know, including the criminal element, as evidenced by our officer-involved shooting earlier today, that we are completely operational. We are operating on all 8 cylinders, and every single unit in the Houston Police Department continues to operate efficiently, effectively, and is deployed. As of today at 1:38 p.m., we have a total of 135 members of the Houston Police Department that are in quarantine. 109 are classified sworn members, and 26 are civilians. 110 members of our department have been tested, 106 classified, 17 have come back positive, 43 have come back negative, and 46 are pending. The 17 positive, 43 negative, 46 pending are sworn members, and 4 civilians have been tested. We know that at least 80% or more of the people have very little to no symptoms, but 2 are back to work. We do have 2 members have been hospitalized. 1 is out, still recovering, but is doing well. And sadly, as I reported yesterday, we have 1 member that is currently hospitalized. And our call volume since this stay-home order, the essential functions order only, shelter-in-place order, whatever we want to call it, as of this morning, we're seeing a 7% drop in our call volumes, which is really important. Violence, aggravated assault is up 10%. Domestic violence is just up 0.2%. That speaks to me. Part of that is, we're off a lot of frustration. We're out of our normal routines. But it's important for people to know that we have mental health professionals that you can call. If you need us, call us. We will be there. The other area that I think is important to be aware of in terms of non-violent, you can let us know. Call your local Houston Police Department patrol division, and we will include you in our what we call directed patrols to keep an eye on your business. For actually complying with this order, we have not had to cite anybody. And quite frankly, one of the things that really helped me, and I want to thank you, is taking out the basketball hoops. I'll be real honest.